If you've been diagnosed with diabetes and you want to know how to lower your risk or prevent an amputation, this is the video for you. My name is Dr. Tarr. I'm a board-certified podiatrist in private practice in Phoenix, Arizona, and I own a practice called Direct Podiatry Arizona in Tempe. I do have a playlist talking about especially the diabetic foot and when it comes to wounds or sores on the foot and amputations as well. So feel free to look at my playlist if you're interested. Share this with a family member or friend that is dealing with diabetes. This video has been on my heart for a while, and I finally decided to pull the trigger on it after having a conversation with a woman who knows I'm a podiatrist. And she was asking me about tips for her father-in-law, unfortunately, that recently had his second toe amputated. And so I'm telling her different tips, like I'm going to talk about in this video, things that you should be looking out for or doing to lower your risk. And she goes, "Oh my God, none of his doctors told me this." And that made me really sad for her, because maybe if these things would have been discussed years prior, this amputation could have been avoided. So I'm going to give you the rundown as a board certified foot doctor, as someone who has performed honestly hundreds of amputations, toes, partial foot amputations, things that I commonly see in people that unfortunately end up on the OR table, and how you can lower your risk or prevent amputations in the first place. Why are diabetics known for having a lot of foot problems, especially when it comes to amputations? Diabetes is a very complex disease. The high blood sugars that you're dealing with diabetes cause a lot of changes, really overall to your body, but especially to your feet when it comes to nerves being damaged, known as neuropathy. It causes changes in your skin quality that can make it easier for a wound or a sore to happen. Diabetes can lower your ability to heal, make it a lot slower to heal. That can lead to things like chronic wounds, chronic sores known as ulcers on your feet. Diabetes also can slowly change the shape of your foot over time. So parts of your feet that weren't designed to take up a certain amount of pressure all of a sudden are asked to do a harder job because how your foot is now shaped. A big thing with diabetes, it can lead to atherosclerosis or plaque in your arteries. And arteries are blood vessels responsible for bringing blood away from your heart to other parts of your body. So this example today, we're talking about foot amputation. So the arteries in your feet and legs definitely are impacted by diabetes long term. And over time, with that happening, that lowers your circulation and causes poor circulation to your feet and legs as well. So any type of skin injury that you have to your feet with someone with long-standing diabetes or diabetes that isn't being managed well, you're not getting enough blood flow to that area. And blood flow is also key for healing as well, right? So if you're not getting blood flow, your healing potential is a lot lower, and then any type of sore or cut that you have on your foot or leg just stays open, and that can be a window or a door, unfortunately, to a lot of different infections. And basically, in a nutshell, these are all the reasons why diabetics have a lot higher chance of toe or foot amputations as opposed to people with other diseases, or as opposed to the average person. Things that you can do to help lower your risk of an amputation as a diabetic. One, you want to lower your A1C. I think this is the biggest key. So the higher that your A1C is, and diabetes is diagnosed typically when your A1C is at 7% or more. So your A1C is a measure of your blood sugar range over the last 3 months. It's an average, and of how well your blood sugar is being controlled pre-diabetic. Now, it doesn't mean that you're out of the danger zone of having foot problems. For me personally, pre-diabetes versus diabetes, I treat those patients as if they're the same, because you're still dealing with some form of insulin resistance. Your primary care doctor might have even started you on a medication like metformin. For me, pre-diabetes is kind of saying like you're a little bit pregnant. You can't be a little bit pregnant. You're either pregnant or not. And so even when I see an A1C between 6.5 and 6.9, I still treat those patients as diabetics as well, even if you're not taking medication, because some form of risk is still there. And have I treated patients personally with sores on their feet and their A1C is quote unquote in that pre-diabetic range? Yes, I have. It hasn't happened as often as people with super high A1Cs, but it does come in. So if you're watching this video right now and you kind of fall into that pre-diabetic range, being proactive also for you is super important as well. You're not out of the woods because quickly that 6.5 within a couple years or 6.7 could very likely become 7 and above. Things that work well for our blood sugar control. And yes, diet is one of the things that you want to be mindful of, especially refined carbohydrates, highly processed foods. But on top of diet, sleep. How is your sleep quality? Because if you're sleep deprived, you're not sleeping well enough at night, that definitely can cause stress and increase your blood sugar levels and then your A1C over time. Exercise also is very important. There's so many benefits to exercise, but exercise has been shown to lower blood sugar levels and A1C over time. So with the guidance of your primary care doctor, starting some sort of exercise regimen, moving your body in an intentional way, whatever that means for you. There's a whole deep dive on driving down your A1C that can be discussed, but that really is number one for lowering your risk and preventing a foot and toe amputation. I think definitely that it is important that you have a doctor on your side that is willing to walk with you through that process of bringing down your A1C. And if they aren't willing to sit and have a conversation with you about actionable steps you can take to drive down your A1C, if they don't even believe that it's possible for you, then see another doctor. I personally have family members in my life that were able to get off of metformin, able to go from double-digit A1Cs, 12, to below the pre-diabetic range with lifestyle changes. So it definitely is possible. So you want to find a doctor that's in alignment with that knows and understands that is possible and willing to walk with you during this journey. It is so important. A doctor that's willing to listen to you and monitor you as well. This is something that I definitely wouldn't recommend that you do alone. On top of having a healthy A1C, the second tip for lowering your risk or preventing amputations for me would be daily foot checks. Now, this is really important, especially if you're watching this video and you're already dealing with neuropathy. So neuropathy, again, is nerve damage, but in this specific example, is nerve damage in your feet caused by diabetes or diabetic neuropathy. Peripheral neuropathy is another term. There's a lot of different interchangeable terms. But neuropathy is dangerous because a lot of times, especially when neuropathy is toward its final stages, your feet are numb. You don't feel anything. And so if you have no feeling in your feet, you really have no idea if your foot is injured, if you're getting too much pressure in the area, if you have a break in your skin. And if you're not able to look at your feet every day, or you're just not checking how your feet are, your skin, that honestly is a big cause for a lot of amputations. Because if you can't see something or you can't feel that it's there, then infection can set up shop. And with all the other things that happens in your body and in your feet due to diabetes, it's just almost a perfect storm for infection to happen and amputation. So you want to be checking your feet every day. And usually what I tell people is that there's a couple different ways you can do this. If you're able to bring your leg up, cross one leg over the other, and look at the sole of your foot, you can do that. But don't worry if you're not able to do that. There is, and I'll insert a picture here and also a link to Amazon as well. So this is a mirror. This mirror has a extendable or telescoping handle. And what you're going to do is that every day you can be sitting down on a chair or in bed doing this. You want to take the sole of your foot off the floor and you want to place the mirror with it extended at the bottom of your foot. That's one easy way that you can look at the sole of your foot and see how your skin is looking. If you don't want to buy a mirror like this, that's fine. You can take whatever mirror that you have in your house that's like of a smaller size, place it on the ground in front of you. And then while you're sitting down, you can lift each foot, place it over the mirror, and then you can see what the sole of your foot is looking like. Also, if you live with someone, a family member, a friend, you can have them just quickly glance at your feet every day. And what you're looking for changes to your skin. Any New redness, especially redness that is kind of circle shaped, that is concentrated to one area. Any new blisters, any new calluses, any new cuts, any changes to your skin whatsoever, you definitely want to see a doctor about that, because those can be telltale signs that there's too much pressure in that area, or that that skin is compromised, and those can be areas that will eventually open up and cause a sore or a foot ulcer. The third thing that you can do to prevent amputations is having a podiatrist, a foot doctor, as a part of your care team. So this is important when you're diabetic, just based on, again, everything that we've talked about so far, about all the changes that happen to your feet or can happen to your feet because of diabetes. Again, as podiatrists, we are specialists on everything foot and ankle, so including diabetes. We do a lot of training in regards to the diabetic foot, what happens with diabetes all over the body, but obviously specifically what happens in your feet because of diabetes. Managing wounds, treating wounds, even amputations, unfortunately, if it gets to that point. A lot of people don't know unless they've undergone an amputation or had a family member undergo an amputation that podiatrists do perform surgery amputations as well. That was a big part of my residency training, was performing amputations. But we want to get to you and save your toes, save your feet, and really your leg before you get to that point. So having a podiatrist is definitely very preventative. How often you should be seeing a podiatrist really depends on how well your diabetes is being managed and what other symptoms you're having. If you're someone that's working with your primary care doctor to drive down your A1C, and especially if you're below the A1C of 7, you're not having any other symptoms like swelling, like numbness, tingling, burning in your feet, then usually it's recommended that once a year you go in to see a podiatrist. We will check for certain things like circulation to your feet. We'll check pulses in some of the major arteries in your feet. Check to be sure that your sensation is still there and that there's no changes going on with that. Checking your skin quality, and then that's pretty much it. But if you're someone that has diabetes and you're dealing with neuropathy, you're dealing with poor circulation, then it's recommended that every 2 months you go in to see a podiatrist. And this is because, unfortunately, changes to your feet that can cause an amputation happen very quickly. So that's why you're put on that every 2-month schedule. But again, if you notice something at home that you're concerned about and you have a podiatrist that you've been seeing, call your doctor's office and they will definitely take you in before that 2-month period. You definitely don't want to wait on something like that until your next appointment, because that could honestly be the difference between keeping a toe, keeping your foot, and not keeping. My fourth tip for you for preventing or lowering your risk of amputation is being mindful of walking barefoot, especially if you're someone that's struggling to keep their A1C down. You're also dealing with neuropathy. You're also dealing with circulation issues. Walking barefoot can also lead to foot ulcer and, worst case scenario, amputation, just because, again, if your feet are exposed, you could cut yourself and not know it, or even if you are able to feel it, you're going to have to heal those skin breaks, as opposed to someone who doesn't have diabetes or whose A1C is at normal levels. So I usually tell my patients, especially for the ones that are having other changes to their feet as well, you want to keep something on your feet. So a house shoe. I honestly don't think a sock is enough, just because you need some sort of mechanical protection as well. But wearing a specific pair of slippers that are slippers that you wear at home, house shoes, things like that, that will help protect your skin. My fifth tip for lowering your risk of toe or foot amputation, being mindful of temperatures that your feet are exposed to, extreme hot or extreme cold. I did my residency training in Cleveland, Ohio, and I have stories for days, unfortunately, stories for days about patients that went on to having an amputation that were diabetic because their feet were exposed to either extreme high or low temperatures. I remember my first year in residency, and maybe this was like month 4 of residency, I had a patient come in. He was young. He was probably around my age, in his early 30s, type 1 diabetic. And it was wintertime in Cleveland, snowing at that time. His feet were exposed to very, very cold temps. His socks got wet because of the snow and because of other issues that he was having, health issues. He wasn't able to change his socks to warm up his feet in time. He eventually developed wounds or sores to his feet, and we ended up doing a TMA or transmetatarsal amputation. So that means that when we take the front of your foot, all toes 1 through 5, and the front of your forefoot. But to the opposite end of that extreme, while I was doing an externship here in Arizona, this was when I was in school before residency started. Also had a patient that was diabetic that had neuropathy as well. And it was summertime when I was here, actually. So he walked barefoot to his mailbox to get the mail one day. And anyone that has experienced summer, especially in Phoenix, Tucson, knows how hot it gets, knows how hot concrete can get in general, not just in Tucson, but anywhere that has, significant summers. So he walked barefoot to his mailbox and back to get mail. But again, he's type 2 diabetic. He had poor circulation and he had neuropathy. So he couldn't feel that the ground was burning him. And he said he finally realized that something was wrong, that after a couple days of him being at home, he smelled an odor. And then he looked down on both of his feet and realized that he had wounds to both of his feet. So he was taken to the hospital. He actually developed second, third degree burns, and we were applying skin grafts to both of his feet. Now, I left this rotation after a month, so we were doing his skin grafts while he was hospitalized in an attempt to save his feet, and the skin grafts were taking well, but again, it was a slow process. So we were hoping with this process that he was going to be able to keep both of his feet, but it was kind of touch and go at that point. Another time, I was in Seattle on another externship and had a patient come into clinic that was burned by a space heater trying to warm up his feet. Again, diabetic, also had neuropathy, had no idea that his feet were too close to the space heater. He fell asleep with his feet propped up right in front of it, and then he woke up with burned feet. And we were applying grafts to him too, hoping that the grafts would take and that he wouldn't end up going on to need an amputation. So again, I say all this to say that extreme hot, extreme cold, don't expose your feet to it as a diabetic, because that can lead to different wounds on your feet and just increased risk of amputation. My sixth tip for lowering your risk or preventing a toe or foot amputation is also being mindful of the shoes that you wear. So a lot of people don't know this, but if you are Medicare age or you're covered under Medicare for another reason, and if you're watching this from the United States, Medicare is a government-sponsored plan that's for people here over 65, or if you have certain conditions and you're under the age of 65, that Medicare will cover. So if you're covered under Medicare for any reason and you are diabetic, Medicare has a shoe program, and they will pay for 1 pair of custom shoes and 3 to 4 pairs of orthotics or shoe inserts annually every year. Unfortunately, a lot of people don't know about this, but it's really important to be aware of, especially if you're covered by Medicare, because diabetic custom shoes can be very expensive. They can be upwards of a couple $100s, unfortunately. So if you are covered under Medicare, it's something that you should tap into. And this is one of the many important reasons of having a primary care doctor. As they're working with you to drive down your A1C, they also have to sign the paperwork for these shoes. If you're not seeing podiatrist that has diabetic shoes in their office or doesn't dispense them in their office, then a lot of times the order has to come from your primary care doctor. And then they will send it off to Medicare. Medicare approves it and then pays for the shoes. So molds are taken of your feet, your inserts are made, your shoes are made. And again, diabetic shoes look a lot better than how they used to look maybe 10 to 15 years ago. They have, honestly, a lot of good styles, a lot of good colors. They look very stylish. You wouldn't know if you're not, a podiatrist or a pedorthist that you're looking at diabetic shoes. They just look like everyday shoes. But diabetic shoes are a good thing to have when you're dealing with diabetes, because there's certain aspects of diabetic shoes that set them apart from kind of like your run-of-the-mill shoes. One, they are custom-made, tailor-made to your foot. Diabetic shoes also tend to be seamless on the inside, tagless on the inside. Also, too, with diabetic shoes, Because they are custom built and custom made to your foot, they fit you perfectly. Sometimes with diabetes, what can happen is that your foot can start to change shape. You can have issues with hammer toes and bunions. Maybe your arch becomes super high or your arch completely collapses. And that can lead to pressure points on your foot. And the pressure points, especially over time, if they aren't addressed, can definitely lead to sores or ulcers on your feet. So diabetic shoes too, because they are custom made, they will be built around those changes. So less of a worry for things like calluses, corns, or blisters because of shoes being too tight or actually too big. My seventh and final tip for preventing amputations, or at least lowering your risk of them, is you definitely want to be very careful and very intentional when doing the nail salon visit, especially if you have a higher A1C, you have poor circulation, you have neuropathy. And this is really across the board for any type of foot problem, more than just diabetics. I think anyone, especially if you're dealing with neuropathy, needs to be super diligent or skip the run-of-the-mill nail salon visits altogether. And why I say this is because at your local neighborhood nail salon, the staff that are working aren't medical professionals. So them cutting your nails, cutting your calluses, especially in someone with health problems like diabetes, can lead to serious consequences, especially if you're accidentally cut by one of their tools, which if you've ever visited a nail salon before, you know being cut is kind of like par for the course. It's highly likely that something will happen, unfortunately. So again, with diabetes, you want to be super careful of any cuts, any nicks, any scrapes, because that can lead to infection, to ulcers, and eventually to amputation. I tell diabetic patients, especially if your A1C is higher than 7, and definitely if you're dealing with sensation changes, neuropathy, or poor circulation, just to skip the nail salon altogether. Instead, if you still want to get your nails done, there's a safe way to do it. You can go get something called a medical pedicure. And medical pedicures are performed by healthcare professionals. So doctors, nurses, or medical pedicurists, depending on the location, whether it's in a standalone kind of med spa or if it's attached to a podiatrist office. I think the medical pedicure, it is kind of like a branding term, but it goes kind of a step ahead of going to your local foot doctor or podiatrist and getting your nails trimmed every so often, getting calluses trimmed. Those things are important, definitely for sure. The medical pedicure is more of a spa-like experience. It's waterless, unlike going to your run-of-the-mill neighborhood nail salon, which is because especially those bowls, even when they're lined with plastic, can still be a source of infection. Instruments will always be sterilized in a medical pedicure setting, and usually steam is used to hydrate the skin. The person performing the medical pedicure really takes their time to trim your nails, trim calluses, to moisturize your skin, even including massages. And they even at some places will paint your toenails too for an additional fee. And the big thing is, especially with the medical pedicure, if there's anything that the person performing the pedicure notices, if that's the doctor that's actually doing it, the medical pedicure, they will call it to your attention, treat it. Or if you're in, let's say, a med spa and there's not a podiatrist or foot doctor on site, they will let you know, hey, I notice a blister. I notice this redness here. I notice this callus. This can potentially lead to a sore or ulcer. Let's have you follow up with a foot doctor. So I actually am a fan of the medical pedicure. And if you want a little bit more than what is done at a podiatrist office, again, it's not for everybody. But for some people that, kind of like that spa experience, like to feel pampered, then I definitely think it's a good way to still have that, but not put yourself in danger by going to a regular nail salon. So a medical pedicure is not something, unfortunately, that I offer at my office right now, but I do plan on offering it in the feel free to subscribe to this channel. I'll definitely update everyone once I add that on as a service in my office. So I know some people will say too, hey doc, I'm diabetic and I go to, the neighborhood nail salon every month or every 3 weeks for my pedicure and nothing bad has happened. And if that's you, you're very fortunate. But again, I can't in good faith recommend that someone, especially with diabetes, go to a regular nail salon to have nails trimmed, calluses trimmed, just because the risk is too high. So story time, I had a patient, and this was actually one of my last patients in residency, and she came to our clinic and she was a nurse. Again, very medically savvy, and she had an infection in her toe that had been going on for about 3 weeks at this point. She said that she was a fan of the nail salon, normally went to the nail salon to get her mani-pedi every couple weeks. Well, this time in particular, someone there cut her big toe, and she noticed redness, swelling, all the typical infection signs. She found someone, I guess a friend, to write her prescription for an antibiotic, thinking that that would help, but it didn't. She ended up developing gangrene, and about 2 days later, she was on the OR table, and I had to amputate her big toe. So again, it is something that happens. Again, I say this to just keep you informed, err on the side of caution. There are other ways that you can practice self-care, but keep yourself safe at the same time. So that is it, everyone. My 7 tips for avoiding an amputation, or at least lowering your risk of one. Again, I will include my diabetic foot or diabetes and your feet playlist here. Check out my other videos that I've made. And until next time, everyone, take care. Bye.